Welcome to our deep dive, exploring the accuracy of using a urinary dipstick for canine CSF analysis.
We're going to really delve into whether this readily available tool can give us trustworthy measurements of protein and glucose in CSF.
And how those measurements stack up against the results from standard lab methods.
Right.
Our main source is a research article from JVMA.
Accuracy of urinary dipstick for glucose and protein determination in canine cerebrospinal fluid.
Catchy title.
It does grab your attention.
So analyzing CSF is a cornerstone of diagnosing neurological diseases in dogs, right?
Absolutely. It gives us that critical insight into what's happening in the central nervous system.
Like a window into the brain and spinal cord.
Exactly.
This particular study zeroed in on dogs suspected of having canine distemper virus and showing neurological signs. Why distemper specifically?
Well, as you know, canine distemper virus often targets the central nervous system,
leading to those neurological complications.
Yeah.
So these dogs were prime candidates for CSF analysis because there was a high chance of finding something abnormal.
Makes sense.
So the researchers took CSF samples from 22 dogs
and analyzed them using two methods, the urinary dipstick, which we'll call UD for short, and then good old-fashioned laboratory biochemistry techniques.
The biochemistry techniques are our gold standard, providing the most accurate and reliable measurements.
Precisely.
So it seems like they were basically putting the UD to the test.
To see if it could be a practical alternative to those more time-consuming and expensive lab methods.
Now, I'm curious, why would anyone even think of using a UD for CSF analysis in the first place?
It's tempting, right? UDs are readily available, cheap, and they give you quick results right there in the clinic.
So you can imagine the appeal in a busy practice.
Definitely.
Plus, I've heard of some vets using UDs for a quick CSF check.
There's even been some human studies that have shown a decent correlation between UD and standard lab results for some things.
So there was at least some rationale for exploring its potential in canine CSF.
Sure.
But as with any diagnostic tool, you absolutely have to validate its accuracy, especially in the context you're using it in.
Couldn't agree more.
And that's where this study comes in.
They meticulously compared the results from the UD and biochemistry for both protein and glucose levels.
So did the UD live up to the hype?
Well, that's where things get really interesting.
All right, I'm hooked. Tell me more.
The study found a pretty significant discrepancy between the UD and biochemistry results.
Uh-oh, that doesn't sound good.
And you'd be right. They found a 64% divergence between the two methods for protein, with the UD often underestimating the protein levels.
So not great.
No, not really.
And what about glucose?
Even worse, a 73% divergence.
Yikes.
And the UB was frequently overestimating the glucose levels.
So it's not just that it's inaccurate, it's inconsistent too.
Exactly, and that's clinically significant because increased protein and decreased glucose in CSF are often red flags, pointing towards a disease process.
So if we relied only on the UD, we could miss those crucial indicators and end up misdiagnosing our patients.
That's the crux of the matter.
And the consequences could be pretty serious.
Absolutely.
So let's dig into the data a bit more, get a clearer picture of these discrepancies.
Good idea.
The study has several tables that break down the findings, right?
Right.
Table 2, for example, compares the UD and biochemistry scores for each individual CSF sample. Can you walk us through it?
Sure. The table lays out the UD score, the biochemistry score, and the difference between the two.
For both protein and glucose?
Yes, for both.
And how do they come up with these scores?
Well, they had to convert those quantitative biochemistry results into a scoring system.
To make it easier to compare with the qualitative UD results.
Right. So basically a higher score means a higher concentration of protein or glucose.
Makes sense.
And when you look at table 2, you see this consistent pattern
of underestimation for protein and overestimation for glucose with the UD.
Yeah, it's pretty striking.
Can you give us a specific example?
Sure, let's take sample number 7.
Okay.
The UD score for protein was 0, while the biochemistry score was 2, a difference of nit 2.
So the UD really underestimated the protein level in that sample.
Yeah, significantly.
And what about for glucose?
Let's look at sample 21.
Right.
The UD score was 4 and the biochemistry score was 2, so a difference of +2 this time.
Meaning the UD overestimated the glucose level.
Right.
So we're seeing that same pattern repeat itself throughout the table.
Yeah, highlighting just how inconsistent the UD is.
Concerning, to say the least.
It is.
Now, earlier we talked about cutoff levels. And tables 3 and 4 give us more insight into how the UD performs at different cutoff levels.
That's right.
These tables show us the true positive, false positive, true negative, and false negative results for both protein and glucose.
based on 2 different cutoff levels for each.
Just to clarify, what do those terms mean exactly?
Sure. So a true positive means the UD correctly identified a sample as having an elevated level of protein or glucose,
Which the biochemistry then confirmed?
Yeah.
And a false positive.
That's when the UD indicates an elevated level when the biochemistry shows it's actually within the normal range.
Like a false alarm. And what about true negative and false negative?
A true negative is when the UD correctly identified a sample as having a normal level, again, confirmed by biochemistry.
And a false negative means the UD missed an elevated level that was actually there.
Right. The biochemistry caught it, but the UD didn't.
Okay, that makes sense.
So looking at how the UD performed at these different cutoff levels, let's start with Table 3, which focuses on protein.
All right.
At a cutoff level of 15 milli-GDL, the UD correctly identified 15 samples as having elevated protein levels.
Those are our true positives.
Yeah, but it also missed 4 samples that were actually positive according to the biochemistry.
Those are the false negatives.
Right.
And when they bumped the cutoff level up to 30 milli-GDL, the number of false negatives increased to 9.
It seems like as those protein levels go up, the UD gets worse at detecting them.
Not good.
Nope.
All right, let's shift gears to Table 4 and look at glucose.
Okay.
So at a cutoff level of 40 milli-GDL, the UD only had 2 false negatives.
Sounds promising.
But there were also 2 false positives,
So sometimes it's overestimating glucose levels.
which could lead to unnecessary worry or extra testing.
Absolutely.
And then, when they raised the cutoff level to 100 milli-GDL, the number of false positives skyrocketed to 12.
Yeah, that's a big jump.
So again, it seems like the higher the level, the more likely the UD is to get it wrong.
It does seem that way.
So we've seen the true and false positives and negatives. But to really understand the UD's validity, we need to look at those statistical measures you mentioned.
Sensitivity, specificity, predictive values, and accuracy.
Exactly. Let's dive into those in the next part of our deep dives. Okay, so we've really dissected those raw data discrepancies and seen how they play out at different cutoff levels.
Right. Now it's time to tackle those statistical measures. Sensitivity, specificity, predictive values, and accuracy.
Because these are key for assessing the validity of any diagnostic test.
Absolutely. They give us a standardized way to evaluate how well a test performs.
In terms of correctly identifying both positive and negative cases.
Yeah.
Table 5 in the study summarizes these statistics for the UD at various cutoff levels. Let's focus on the cutoff levels that gave us the best accuracy for protein and glucose,
Okay.
which were 15 milli-GDL for protein and 40 milli-GDL for glucose.
Sounds good.
So, tell me, how did the UD perform at those levels?
Well, for protein, the UD had a sensitivity of 78.9% at that 15 milli-GDL cutoff.
Meaning it correctly identified almost 79% of the samples that actually had elevated protein levels based on the biochemistry.
That's right.
But the specificity at that same cutoff was only 66.7%.
Yeah, so it only correctly identified about 67% of the samples with normal protein levels.
So it's decent at detecting elevated protein, but not so great at rolling it out when it's not there.
Exactly, and that could lead to some false alarms and potentially unnecessary further investigation.
Which is not ideal.
No, not at all.
Now, what about those predictive values?
Okay, so at the 15 mg/dl cutoff for protein, the positive predictive value is 93.7%.
So if the UD says it's positive for protein, there's a high chance it's actually a true positive.
Yes, very often.
But the negative predictive value at that cutoff is only 33.3%.
Meaning if the UD gives you a negative result for protein, there's a good chance it could be a false negative.
So we have to be really careful interpreting those negative results from the UD for protein.
Absolutely.
Now, switching gears to glucose at that 40 mg/dl cutoff, the sensitivity for glucose is even higher at 89.5%.
So it's really good at detecting those elevated glucose levels.
But the specificity drops down to 33.3%.
Meaning it often flags samples as having elevated glucose even when they're normal based on the biochemistry.
So prone to false positives for glucose.
Right.
The positive predictive value is good at 89.5%.
But the negative predictive value is again only 33.3%, mirroring what we saw with protein.
So again, we have to be cautious with those negative results.
Definitely.
And finally, the overall accuracy, considering both correct positive and correct negative results, was 77.3% for protein and 81.8% for glucose at those cutoff levels.
Right.
Those numbers might seem okay on the surface,
But they're not reliable enough for us to make those critical clinical decisions.
especially when we think about the potential consequences of getting the diagnosis wrong and not treating appropriately.
Exactly.
So, while the UD might seem like a handy tool for a quick CSF assessment, this research really highlights its limitations.
Especially when it comes to accurately figuring out protein and glucose levels.
The big question then is, will we see a CSF-specific dipstick developed that can overcome these limitations?
That's the burning question, one the researchers themselves are advocating for.
Something tailored to the unique characteristics of CSF.
Because until then, relying solely on the UD for CSF analysis could lead to misdiagnosis and potentially compromise patient care.
This deep dive has been eye-opening, to say the least.
It really underscores the importance of critically evaluating those readily available tools
Before we apply them to new diagnostic situations.
and it highlights the need for more accurate and reliable methods for analyzing CSF.
From Vet NeuroJar, keep those minds inspired, hearts light, and tails wagging.